Hi and welcome back to the channel. My name's Holly and I'm a clinical psychologist working in the NHS in the UK. Today we're going to be talking about some of the key similarities and differences that I've noticed between being a trainee clinical psychologist and a qualified clinical psychologist. It is one of the most common questions I get asked. Invariably, everybody asks me once a month on my monthly Q&A. So I like to, hopefully this video will answer some of those questions a little bit. And also, hopefully, it will be helpful for people that might be coming towards the end of training and starting to think about being a qualified psychologist, or also people that might just be interested in what we do as qualified psychologists or trainee psychologists, or thinking about going on to clinical training. So firstly, we'll outline a little bit about what a trainee clinical psychologist does and what they are, and similarly with a qualified clinical psychologist as well. And I'll tell you a little bit about my background. So a trainee clinical psychologist, they are somebody who is studying on a doctorate in clinical psychology in the UK, which involves working clinically, so on placements, kind of working as a psychologist under supervision, conducting research and learning the skills that you need to work as a qualified clinical psychologist. The trainee clinical psychologist also studies at a university, so the courses are all run through universities, and then also has a range of kind of clinical placements in lots of different settings to develop some of the really key competencies you need. In terms of what a qualified psychologist does, we'll come again to those kind of differences, but a qualified clinical psychologist is somebody who has undergone that training programme. So in the UK, that is by completing a DClin Psy or doctorate in clinical psychology. Although qualified clinical psychologists that work in practice in private and NHS settings in the UK don't always have to have trained here. There's lots of other training across the world to become a psychologist. That learning can be brought over to this country, and kind of you can work as a chartered psychologist here as long as the bodies think that you can. Clinical psychologists work in a range of different areas. It could be mental health, it could be crisis, it could be physical health settings, acute settings, forensic, inpatient, outpatient, secure settings, educational settings, and also with a lot of different people. So trainee clinical psychologists they go through, part of the training is going through working across the lifespan. So you will work with children and families, you'll work with older adults and everything in between. There's a really broad range of people that clinical psychologists can work with. Finally, what they actually do is kind of offer psychotherapy, and we're often trained in lots of models, and we work as part of a team. So that could be a multidisciplinary team with doctors and psychiatrists and nurses, and physiotherapists and lots of other professions, and also offering supervision to those professions or to other psychologists as well, and particularly training and consultation. They're big features of the work too. So in my role, I have been qualified since September 2024. So at the time of recording this video, that is 9 months of qualified time, which feels like an unbelievable amount of time, really. And at the moment, I work in an acute hospital, mainly focusing on cancer. And I work in a really big team full of really experienced psychologists, counsellors and therapists. And it's one of the reasons that I wanted to work in that service as a newly qualified member of staff, because being around a team is really, really supportive place to be. I didn't want to be the only psychologist somewhere being newly qualified. So that was important for me. And actually I do work now where I was placed for my 3rd year. So that's nice. So I've already kind of been there a year as a trainee and now coming in as a newly qualified. So yeah, I've really enjoyed my 9 months as a qualified member of staff, and we will go through a little bit of why that is in a minute. So let's get into the differences then. The first one is pay. Okay, so we live in a very money focused society. Let's not beat around the bush. Money is a difference. So as a trainee clinical psychologist, you are paid at the Agenda for Change NHS scale, band 6. And you are an NHS employee, and you have clinical placements in lots of different trusts, but you are employed by one trust that is usually associated kind of around the area. So for example, I trained on the Oxford course, so Oxford Health was my employer, for example. With the kind of pay and the scaling with that, there is quite a clear development focus and framework to ensure that competencies are developed. And as long as you're kind of meeting all of those things and you've done all your mandatory training and things like that, you can then progress. So after 2 years, you go up a little bit in the band, so you get paid a little bit more. As a qualified member of staff, you start as a minimum will be a band 7. In fact, actually, that's not quite true. If you haven't finished all your research stuff, but you've passed all your clinical work, then you can work as a psychologist. I think your title is still trainee because you've got to do the research side. So like if your dissertation is delayed for any reason, your thesis, then that might mean that you can work clinically for a bit while having your trainee contract slightly extended a little bit. But you would then continue that work on a band 6. So, bit complicated. It doesn't always happen, but it does happen as well sometimes. So, typically, you will start out at band 7. And because recruitment has been a bit of a challenge recently, there have been a lot of preceptorship roles. And a preceptorship role is where the service will offer you starting at a band 7, and they would help you over the next sort of 18 months to 2 years to develop all the competencies that you might need to get to an 8A. And the idea is that then after that time, if you've passed all of those, then you'll be working on an 8A salary. So there's a couple of options. You can either come out at a band 7, which there are lots of newly qualifieds that do that, and that's kind of the kind of, hopefully you wouldn't be like leading a service or doing anything like that. That would be kind of, getting in some hours post qualification and kind of doing some of the work and getting to know yourself a bit as a clinician. There is a preceptorship, so that's a 7 to 8A, and at that time frame might be different depending on the trust and what's agreed in the service. And you also could potentially go straight into an 8A depending on the situation and what's available. And yeah, so some people do that too. So there are options, but that does demonstrate quite a jump in pay. So yeah, that's one of the really positive things about being qualified, is that you get a bit of a pay rise, which is nice. And of course, some people do go straight into private practice, which I have my feelings about, and we will get into that another time perhaps. If on a preceptorship, it's a kind of similar sort of framework to kind of like to training. So you might, they might say, right, these are the competencies of a newly qualified, these are the competencies of an 8A. Let's look at how to get you to that level of competence, similar to how you might do on training, but certainly less intense. The second difference I want to talk about is work, which feels like a really broad topic. Firstly, as a trainee clinical psychologist, you have a caseload which includes a range of complexity and presentation, with kind of the aim is to get some varied experience in there. You'll offer therapy, you'll be doing groups probably, likely to involve some service development and audit type of stuff, and perhaps some more kind of resource development things and like smaller scale projects, things like that. Lots of shadowing opportunities too. And yeah, so that kind of is what that work looks like on clinical placement. As a qualified psychologist, you're sort of generally only doing the clinical placement bit of training rather than doing the research and the essays and all the other bits that you have to do. So as a qualified psychologist, your workload can look quite different. And obviously this is all based on my experience, but lots of people have different experiences too. So when I qualified, we had quite a clear job plan about how many people I needed to see in a week, what that would look like, and my role is funded through cancer, so that's kind of the main bulk of my caseload needs to be working with people with cancer. So the caseload includes, again, a range of complexity and presentations, probably likely to be slightly more complex than when I was a trainee, but I guess it's a bit different. So sometimes there may be cases on training that you see that may be slightly more complex, and that's really good for learning. Sometimes it might be actually there's complexity that's too risky for a trainee to manage, and that simply won't really be a thing when you're qualified, really. It's not, there isn't that whole idea about risk. The idea is that you should be able to manage that risk often. That isn't to say you do it without support, though. That's important to say. But a lot of this will depend on your service and the kind of the banding that you're at and what the expectations are, and also what's been agreed. Also, qualified psychologists will be doing therapy. That will probably be a big bulk of newly qualified's work because, again, at that banding, you're probably going to be doing more of that stuff rather than a lot of leadership-y type stuff. Could involve groups as well, depending on the service. and is likely to involve some service development and audity type things as well, again, depending on the level. And the one thing I would notice is that I definitely do a lot more training and supervision. So I supervise some cancer specialist nurses, and offer some support and kind of reflective practice to our hospice and things like that. So they are things that I wasn't doing on my own as a trainee, but definitely do qualified. And I often do a bit more kind of trainee stuff too. And that you could potentially expect that more in an 8A or preceptorship type of role as well. The two last things on my list for this are big. They're probably the biggest difference. Firstly is clinical responsibility. So I was heavily aware when I qualified. I was really nervous about having my own clinical responsibility, which is weird because even as a trainee, you know, if anything were to happen and we did something really wrong, all right, our supervisor might, you know, that it's ultimately their responsibility, but we still have our responsibility to it. But there was something a bit scary about those training wheels coming off and being like, okay, what if I do something? And I remember in my first week being really scared that I was going to do something to get me struck off, and it was really scary. And towards the end of training, we had a really useful, I don't think they shouldn't do this, I think they should, a really useful teaching on kind of HCPC fitness to practice regulations and what happens if an investigation is launched and cases where people have been struck off. And I just became a little bit obsessed with looking at the outcomes of the HCPC tribunals and things, which probably wasn't that helpful actually thinking about it. But yeah, that's definitely something that's left me, having got more experience now as a qualified member of staff, and having confidence in my competence. That's definitely changed. But that's definitely something I was aware of, particularly in my first week as a qualified, first week or two at least, of being qualified. So that feels like quite a big difference in the work. Even though you're doing all the same things, it still feels slightly different. And the next thing I want to say is probably specific to me, but I think a lot of other people do feel this way too. My workload went significantly down after training, and that's complicated. So I see a lot more patients. But what I mean is I'm just doing the clinical stuff. I'm just working in the role. I'm just doing the job. I'm not having to try and fumble my way through some research or do loads of essays. And I think the main difference for me is that since qualifying, I'm able to leave work at work, come home and relax. Whereas on training, there's constantly for me, a feeling of, I should be doing this. Like I should be doing this essay and I've got all this hanging over me. Like I'm one of those people that likes to start the coursework when we get given it, you know, rather than wait. So it always feels like it's hanging over me. So yeah, I think that's one of the biggest things is that I feel so much more like I can enjoy my life in a different way than I could do on training. And ultimately, a lot of us go into this because we really like the clinical side. We want to do the work. We want to work with people. We want to support people. We want to develop services. We want to do those things. So yeah, I think that feels like quite a big thing as well. And I think I come to this a little bit later, but just having a bit more freedom and not having to tick off so many boxes because on training that is just what you have to do. You have to tick through lots of boxes and develop lots of competence and different skills in different areas. But as qualified, you can choose almost which skills that you want to develop further rather than it kind of being prescribed, which they have to do on training. So yeah, I think that feels like a big difference for me. Another key difference is supervision. So as a trainee, you will usually have at least 1 hour a week of clinical supervision with your placement supervisor. You'll also have research supervision, which could be between 1 and 4 supervisors per project. So it's a lot of people. And you also usually will have supervision from a member of the university staff, the course team, to make sure that you're okay, and kind of a bit more line management-y kind of supervision and just checking in with you. So yeah, that's kind of supervision as a trainee. As a qualified, this can really vary. But a band 7 newly qualified psychologist will probably have supervision around once a fortnight. Could be once a week still, depending on the service, depending on how that all goes. But often it's, once a fortnight. And a band 8A will typically have supervision around once every 4 to 6 weeks. which is a big difference. Actually, if you think about weekly to every 5 weeks, that's a big difference in time. And even if you go straight in at an 8A, you may not be expected to go straight to 4 to 6 week, supervision. It might go from 2 to 3 to, it might be a phase. And again, if you're on a preceptorship, that will probably change over time too. But the amount of supervision, and also you don't have research supervision, you will have a line manager, but that person could be the same person as your clinical supervisor. And you're probably meeting with them in less contacts probably with them in terms of line management than you would be with your course tutor type person. So yeah, significantly fewer supervisors, which is not necessarily a bad thing, because I think the structure of training and having lots of supervisors is beneficial actually, and you learn from a lot of people. And I had some brilliant supervisors across my training, and that was, yeah, I really felt like I learned a lot from most people. But as a qualified, I think it's nice that you can build that relationship, that kind of longer term relationship with somebody, and to kind of have that supervision side of things is just different. And yeah, I think also the spacing means that you have more space to develop a sense of self as a clinician and as a psychologist. Whereas as a trainee, there is some focus on that, but they only have a finite amount of time, and they have to get you doing those competencies. They have to get you past. So it's not so much about who you want to be as a clinician, really. I feel like I've learned that so much more in the last 9 months. And the therapy that I'm doing now, I feel like is so different to what I would have been doing at all through training. And I felt like through training, I progressed massively. So from first placement to sixth placement, it felt like a huge progression, but actually sixth placement to now feels like an almost equal progression. So it's that freedom and that space to kind of explore yourself as a clinician is a really helpful thing, I think. And again, like I said, there's just slightly fewer restrictions and hoops to jump through. I say slightly, I think there's quite a lot more, like a lot less. But I understand why training needs to be that way. So now I want to talk a little bit about the similarities that I've noticed in being a trainee and a qualified psychologist. Firstly, for me, starting as a trainee was really difficult. I found myself just so anxious. My anxiety was just through the roof, and it made it really difficult to manage all the pressures, and the pressures that I was putting on myself, and also that I kind of perceived as well. I also had not an amazing start on placement. There were some challenges in the first half of my first placement that I would have handled differently had I had a placement before, and it wasn't my first experience. So yeah, that was really tricky. And I found basically my imposter syndrome, I was like, okay, I need to quit. I thought I was going to get kicked off. I was convinced. I was also convinced for most of training that I wasn't going to pass. And everybody around me was saying, what are you do? Oh, shut up. Of course you're going to pass. Even all my supervisors, and one of which was the course director, was like, you are going to pass. You'll be fine. Like, what are you worried about? And I was like, I just worry. But anyway, that was really difficult. And the imposter syndrome was very much there, telling me that I was not going to pass, was not going to do it, that they made a mistake with me, those sorts of things. As a qualified, I was anxious too. So starting as a qualified, I had a 3-week break from training finishing to starting qualified, my qualified role. And I needed that break so badly because I was really exhausted. Training is an ordeal. It's a real marathon to get through. And yeah, I needed time to decompress, and that was nowhere near enough. I didn't feel fully decompressed for a good few months. And I do definitely feel like that now. I feel really positive now. But I needed some time to fully decompress from all of that and work out who I was. So when I first started in my role, obviously I'd been there before for a year as a trainee, so I sort of knew everybody, and that was really nice. But I remember in that first couple of weeks, like I said before, being so anxious. Just that I was going to make a mistake, that I shouldn't have my training wheels off so soon, and things were going to go badly. I definitely had that. But that quite quickly dropped as I started doing the work. And I think it also probably went around the time, went pretty much around the time that I felt less burnt out as well. So after a few months of decompressing. And, don't get me wrong, there are definitely still times that I worry that I'm not doing the right thing. But actually having some freedom to develop myself as a clinician outside of the kind of limits of the course and the bounds of what they kind of have to instill in you has been really positive in terms of managing some of that imposter syndrome. It definitely flares up less and less, and I've got more evidence to suggest that actually I do know a bit about what I'm doing and it's going to be okay. And even if it isn't, I've got ways of managing, and that I feel supported in the team, and we all make mistakes and it's all okay. That's really well modelled in our team, that we can ask for support at whatever level you are, and that's okay. So yeah, I think it definitely flares up less and less, but there are probably situations that trigger me more than others, but I'm more aware of those now than I probably was, particularly at the start of training. So imposter syndrome still is there, but it definitely feels more manageable, and I'm far more aware of it, if that makes sense. Similarity number 2 then is learning. So as a trainee, you are there to learn, right? That is the whole focus of the job. And it's more the focus on your learning and your development as a trainee. And this, I did have that. That was my experience, pretty much, that it was, here's the things that we think you've learned before training. Here are the things that we still think are real gaps or things that need to further develop. And this is what we're going to do to try and get you that with all of these different placements and things. So that was a real focus, and it's kind of like a personal development plan. And you've got so many people around you supporting you with that, which feels so different to lots of other roles before. And you do lots of shadowing as a trainee. There's loads of it. And generally, the teams are pretty okay with you shadowing. Like, they're quite keen, depending on the team. Sometimes they may not be. But there's lots of shadowing opportunities. And if you say, I'm a trainee, would it be okay if I shadowed you for the morning? That's fine. That happens slightly less as a qualified, I would say. But what I would say is, as a newly qualified, I'm in such a supportive team, there's a focus on development too, but it's less kind of formal and structured. And I don't think, this isn't necessarily always the case, but this has been for me, I think. But I've also really enjoyed that ability to kind of choose what CPD I want to do, and what I want to learn about and what feels useful, rather than this is a prescribed curriculum, But again, that's what they have to do on training. And the other thing I would say about learning is that there's more focus as a qualified member of staff on learning within the context of your job plan and what's useful. So, for example, lots of my first bit of CPD that I was doing was around kind of supervision of other professionals and that sort of stuff, because I hadn't really done loads of that. So that was one of the first things that I focused on. And rather than being able to kind of shadow lots of things, there wasn't loads of opportunity for that. I'm sure that I could find opportunity for that, but it's just not quite, the door isn't quite as open as it would be for a trainee, I think. But yeah, the focus on learning feels slightly more applicable to the job that I'm doing in my future. And particularly thinking about how you have to kind of evidence your CPD through the HCPC if you're requested, you might be audited. So as a member of the kind of a registered member of the HCPC, you can be audited, and they might say, show us all your CPD to make sure that you're actually doing it. So you need to kind of log it and keep notes and that sort of thing. And that again feels a bit freer. There isn't loads of time for that on training. So it's really nice to be able to have that time as a qualified. Again, it's just nice to have a bit of extra time to decide what you want to do with it. In terms of general reflections then, between being a trainee and being qualified, I think I really am immeasurably happier than I was on training. And that isn't to say that I was really low on training. I posted loads of videos on training. You can see that I enjoyed it, but also that it was stressful. There is a lot that you have to do. There's a lot of things that you had to get through. But I think ultimately for me, having some freedom to develop as a clinician outside of those bounds and that context of training, and the rules of the course and the kind of curriculum has been really helpful. And I think it's a really nice, that newly qualified time that I've had in the service that I've been in has been a really lovely, almost kind of fourth year to training, if you like. It's been really, really lovely to be able to do all of those things. And the other thing is, I just love being able to leave work at work and not constantly be thinking I should be doing something. It's a really nice feeling, and I've very much embraced it in the last 9 months. So they are my general reflections about being kind of a trainee versus a qualified psychologist. And I'm sure as I progress through my qualified life, I will have lots more reflections for you. Let me know if you want to hear any more about qualified life or trainee life down in the comments. Thank you so much for watching, and we'll see you next time. Bye-bye.